right. Hi, guys. Welcome back to another week, another episode of Unlicensed. If this is your first time tuning in, my name is Jill. I am the host of Unlicensed, and this is the podcast where real women write in anonymously about anything that they want, anything on their hearts, on their minds. And I bring in different female guests each week, including relationship coaches, therapists, friends, family, and social media influencers to help offer you guys this advice. I am so excited for today's episode. We are joined by health innovation and strategy leader Elise Lockamy-Kassim. Elise is a public health executive with almost 20 years of experience within health equity initiatives. She has expertise in bridging healthcare, corporate, and nonprofit sectors to address the social determinants of health. So welcome, Elise. I'm so excited to have you here.
Thank you so much, Jill. I'm excited to be here.
I'm excited. We've never done an episode, and we'll get into what we're doing in a second, but we've never done an episode like this, I think, in my last 3 years of doing this as a podcast. So I'm super excited to dive into it because especially with everything going on in the world right now, super important topic.
Absolutely.
Obviously, before we get into the advice, we like to get to know our guests a little bit more, learn into more about you, your expertise. So I have some questions that I want to ask you. Starting off with, you're from Brooklyn originally.
I am.
You went to college in DC at Georgetown. So did your upbringing in New York make you interested in healthcare, this background, or was it being in a city like DC, which is obviously so pivotal with policies and everything related to this care? What made you interested in the field that you're in now?
You mapped that better than I could say it. That was such a nice culmination. So definitely my Brooklyn, New York upbringing influenced everything. I mean, it's still a big part of who I am today. So I am the granddaughter of Elijah Lockamy, who was an African-American man who migrated from North Carolina up to Brooklyn during the Great Migration of Black Americans to the North. And so they went up looking for safety, right? Looking for good union jobs. And when my grandfather landed in Brooklyn, you can imagine the state of the community. There were vacant homes and dilapidated homes. There were just lack of public safety, just basic needs that he did not see. Yeah. And so he became a community organizer. I mean, not aiming to be and take on that title, but just came to be that and evolved to be that. And so by the time I'm in elementary school, Grandpa is president of the Neighborhood Block Association, and I'm his deputy, right? I'm handing out neighborhood flyers.
5 years old, you're ready.
Yeah, yes. I'm ready. We're doing this. And I can remember vividly, like them taking me to the beautification projects when they're painting, flower pots. I can remember going to the polling station, as they're voting. And it was just so meaningful. Yeah. And I carried that with me all the way through to Georgetown. At Georgetown, you get to see all the layers. And I think everybody's getting a glimpse of that today. All the layers that go into the world around us. It's local, it's federal, right? It's our partnerships. It's our relationships with our neighbors. And in those pretty heady discussions with other academics and talented people, I said, I can be an influencer in this space, and this is where I want to be.
Oh, that's amazing. Yeah. I was doing research on you for this episode. I had no idea about your grandma. That's so amazing. What did your parents' role in that look like too growing up? Were they also very involved? Were they at the polls with you? Yeah. You're 5 years old. They're right there next to you and your grandfather. What did that look like?
My parents, right, are coming from, I almost think of it generationally as like civil rights leaders type parents, right? And then they had civil rights leaders parents, and then they as parents were like freedom organizers. So they allowed me and my siblings to be ourselves. So they saw in us, you want to be a cosmetologist, that's what you're going to be, and we're going to help you to do that. You want to study public health, we don't know everything about that. So the time I graduated, my mom said, you're going to medical school. I said, Mom, this is totally different from medical school. This is not that. Yeah. But the freedom, right, allowed me to be an explorer. And I'm still an explorer today in the work that I do.
That's so amazing. And it's lovely having parents like that are supportive of your endeavors, because a lot of parents aren't like that. So I'm really glad that you had that relationship with them. I'm really interested in how geography has really played a role into your outlook in healthcare in general. Yeah. Obviously, you grew up in New York.
Yes.
Then you were in DC, and then you went to UNC at Chapel Hill. So then you were in the South. So how did all of these different geographical locations really play a role into your overall outlook? You're going from a northern city, Brooklyn, all the way to then the South. And obviously Chapel Hill might be a little more progressive in that sense, but I'm still really interested in how these have played a role in everything for you.
What was consistent in the experience in the North and then in North Carolina I knew that neighborhood development was essential to healthy living. And when I was in Brooklyn, right, neighborhood development looked like, we had sidewalks and we had trees and those types of things, but
Right.
maybe we didn't have safe housing. Maybe there was lead lined windows, right? And
Yep.
then when you go to North Carolina, especially Chapel Hill, I remember doing projects. I would walk into homes with Habitat for Humanity, for example, and someone's home didn't have a floor. It was a dirt floor. And this is 2009.
Yeah.
This is recent. So I said, okay, there's neighborhood development need everywhere in both spaces. And how do we adequately empower community to feel like they have a voice in shaping the world around them?
Yes.
Today, what's been helpful, I just want to talk about my journey a little bit in this time that we're in. Embodiment is really, really essential. So, taking a moment to reflect on what's happening in your body and then being able to move through emotions, difficult feelings. And what I learned from embodiment teachers is that when you're able to move through feelings, you're able to vision. And unfortunately, when I'm looking at Brooklyn or I'm looking at Chapel Hill, we're in both spaces living in somebody else's vision.
Wow.
Right?
Yes.
And so to reclaim our bodies is to reclaim our visioning and capacity to vision so we can build better communities. And so I think even though, again, geographically these spaces are different, it's still the same block for visioning for better. Yeah.
That's really cool how you pull that parallel, because we talk a lot about that body-mind aspect in a more of a mental health lens on the podcast all the time, but it's really cool hearing it applied to this system. I've never thought about it like that before. You got into some of the things that you have seen. You mentioned the dirt floors, I think, in 2009, which is so sad to hear.
Yes.
I know a big part of your current role is driving alignment of policies and programs with the needs of medically underserved communities.
Yes.
I'm really interested if you could elaborate on that more for someone listening in today that might be ignorant of what that looks like, or maybe have had their own privilege that they've never seen communities like that. Can you paint a picture for someone of what communities that have inadequate access to care may look like on kind of that day-to-day basis?
I want to actually flip it and give an example of what it looks like when we do have access.
Okay, love that.
And then pivot into what it looks like if we don't.
Yes.
So I told this story of I'm a healthcare worker, and every year we have to get a flu shot. And so they told us, it's flu shot time. Make sure you make your appointment and get to the right space. Get your flu shot.
Right.
Great. I get the notification via email that I have to get my flu shot. I'm able to get up from my office desk, walk across the street where there are adequate sidewalks and lighting. I was safely able to go across the street and enter a hospital where they had the flu shot available. I was able to get in queue with other healthcare workers. As I'm walking up to receive my flu shot, a nurse comes up to me with a tablet and she says, "Oh, I've got your name. I pulled up your employee ID." She educates me on what type of flu shot's available today, what the adverse effects of getting it will be. She tells me I've got Tylenol for your pain, and we're going to monitor you on the way out. I check in, check the box. I've got all the education. After that, I receive the shot. I receive my monitoring after the shot. And then before I leave and go back to my office, I'm a little bit hungry. So I go over to what is a cafeteria in the hospital, and they've got food lined up as red, yellow, or green. Red meaning maybe not the healthiest choice, and green, we even give you a discount on your food if you choose this one because it's healthy. We know it's going to benefit your body. So I grab my green food, I take it with me, walk safely back to my office, and return to work. That is the example of a system that is working, right, for me to be my healthiest self. I've got education when I need it. I've got the access to the tools. It's working.
Yep.
Unfortunately, at every step in the process I just described, our communities are facing a barrier to getting to where they need to go. You have communities here in Atlanta, and this is not hard for you to see even when you're traveling from the airport, right? You're going from Hartsfield-Jackson up to Sandy Springs, up to West End, and you see differences just from your highway ride. There's no sidewalks. There are no trees.
Yeah.
There are no hospitals even. And so there are communities facing barriers every step of the journey to beneficial health. And so my role and my job is empowering the people who work with me, my teammates, to understand that people have challenges, knowing to meet people where they are. So if I know someone can't cross the street and get to a community clinic location, how can we bring that service to wherever they are, at work, at school, at their church, where they're going normally? How can I advocate for them to have access to a fresh, healthy grocery store instead of the grocery store that's maybe behind the gas station that doesn't have the variety of foods needed for healthy living? So these are the types of programs, partnerships we're designing and elevating, right? So we can make it better for everybody in a healthy system.
Yeah. What you're doing is genuinely amazing. I'm like cheesing over here because the work is so important. And I think we forget a lot of the time about the people that are putting in that effort to make these communities more inclusive of all of these things. So the breakdown of that was actually amazing. I love the visual that you offered me. It's really easy for me to fall in line with that. And we'll get into that more into the episode today too. So I really appreciate that. I obviously want to touch on some of your successes too. In 2017, you were awarded the Young Gov 40 Award by the Atlanta chapter of Young Government Leaders. Since 2019, you have served on the board of directors of Empowerment Resource Centers. In 2023, you were recognized by Diversity MBA as a top 100 under 50 leader in corporate America. You've achieved so much success in your lifetime at such a young age. Would love to hear any advice that you would have for women who are facing imposter syndrome for having higher level of successes at a younger age. I know a lot of women might be 20, 30, and whatever they measure success, if that's financial success or making a change in their communities, and they might feel like, I can't believe I'm the one that's doing these things and being recognized for it too, right? I think a lot of women aren't recognized for it, but what advice would you have for women who are having imposter syndrome about that success that they're facing at a younger age too?
So I didn't share this part of my story, but when I was preparing for high school, I did a program called Prep for Prep. And Prep for Prep takes inner city New York kids who show academic promise and sends them to private schools, whether they're in New York or boarding schools.
Wow, okay.
So I actually attended a New England boarding school called Milton Academy for my 4 years of high school. And while there was this temptation to feel like, ooh, I really don't belong. One, because people don't look like my family here.
Right.
That's the first piece. And secondly, it seems like they're moving through this very comfortably, right? And so I'm not feeling the same way. When I got into the classroom setting with these students, I realized that they weren't smarter than me. They weren't more talented than I was, and I knew that because I was surrounded by gifted, talented Black and brown youth my whole life. And so you have to step back and remind yourself that what I have from my upbringing, from my schooling, has equipped me, right, with enough to sit at this table, and remember that you are enough. You really have to, and talk yourself, coach yourself into that. There's psychology around that. We always find evidence of what we're looking for, whether to the positive or negative. And so you have to flip the switch that, okay, I made a mistake in that meeting. I meant to say it this way, but in the past 10 meetings, I was able to make a good point.
Yes, I love
Give
that.
yourself the evidence that you need to keep pushing forward.
I think that's so important.
Yeah.
Like confirmation bias that's helping you instead of the opposite.
Exactly.
Of I'm doing everything wrong.
Yes.
I love that you were in those classrooms and it just hit you up. I'm supposed to be here. I'm meant to be here. I'm making a difference that a lot of the people that I'm here would not be able to make because of the perspective that you brought in as a woman of color as well.
Right.
I think that's so important. My last question for you, I'm having so much fun. We talk about you the whole time. We'll need like an extra hour. My last question for you is, I read an article where you said the best piece of advice you ever received was spend less time trying to be interesting and more time being interested.
Oh, yeah.
Talk to us about why that piece of advice really spoke to you and how education in general has played such an important role in your life and the impact that you want to have in this world as well.
And, I want to pivot the wording from education and more to curiosity. Be curious, because as we just talked about, right, you can confirm anything that you want to see. And so I have to enter spaces and want to learn more instead of trying to affirm what I already believe.
Definitely.
And that makes me more warm, right? I'm able to connect with people better. I'm able to invite change. So if I come in knowing that, oh, the community needs to look this way, you're going to have a group of people who will reject that immediately. And then we make no progress. And so how can I open up myself to want to learn about someone else's perspective so that we can build together?
Yes.
I want more I want more for everybody.
Yeah.
Yeah.
Curiosity is key. That's what we talk about on this podcast
Yes.
all the time. That's a perfect segue. I hope you guys enjoyed getting to know Elise. I know I have. Thank you so much for being so transparent. That was amazing and everything more. Before we get into the episode, first, a quick word from our sponsors. Guys, today we are sponsored by Plot Twist. This is the dating app that allows women to put dating, connection, and safety first. We talk about all the time on this podcast about some of the reasons that women might be very anxious to try out the dating apps. The first reason is general anxiety, putting yourself out there. It's scary. But the second reason, obviously, is safety. You do not know the person that you're meeting out with, and sometimes you think to yourself, man, if I had my best friend here with me, this would make things a little bit easier. So this is the dating app that allows you to team up with a friend, and you're matched up with other pairs, putting dating connection first, and making things more social, more fun, and ultimately safer for women. What makes it so cool is that it was founded by two female healthcare providers whose mission is to tackle the loneliness epidemic, focusing on emotional, physical, and relational well-being. So if you want to get started on your dating journey today, head to my unlicensed advice, link in bio on my Instagram, or head right to the App Store, click in Plot Twist, use code unlicensed, and you guys will get started on your dating journey today. Back to the episode. I am so excited for today's episode. Like I said, it's something that we've never talked about on this podcast. Super important. We are talking about healthcare. We are talking about some of the issues within it. We are talking about how some women might feel like a number or gaslighted within some of the research in this community. We are talking about everything under the sun. And obviously you are the perfect guest to be here today, as you guys have seen from our opening. So this person wrote in and they said, I'm really frustrated with the healthcare system right now. I've been dealing with intense issues around my cycle and overall well-being for over 2 years. Irregular periods, constant bloating, mood swings, dizziness, and extreme fatigue. I finally took time off work to figure out what's going on because it's too much to manage. I genuinely believe it's stress-related because the symptoms always flare up during high-pressure times at work, but at this point, I've seen multiple doctors, 9 to be exact, including an ENT. Still, no one has real answers, and it feels like none of the providers I've seen actually care. Most of the appointments have felt rushed. When I bring up things I've already tried that didn't work or made things worse, I feel like I'm not being heard. One doctor told me to go back on birth control, and when I explained it had me feeling depressed in the past, she said we should still try it and move forward. I've been feeling more isolated, discouraged, and honestly unsure on how to keep advocating for myself when I keep getting shut down by people who are supposed to just be helping. It's hard not to feel defeated. At this point, I'm starting to wonder if I should just stop trying and learn to live with it. So I have so many questions around this prompt for you. We're going to dive into all the intricacies of everything. But I first want to start off with talking about time constraints and how prioritization of work can get really in the way of someone committing to their health. How often have you seen in your work, or maybe even personally, people avoiding the doctors, checking in on their health because of work, and that being, you know, maybe not feeling like they have enough time in the day because of this 9 to 5 job in this particular instance that's getting in the way of putting their health first?
So I'll go deep a layer and then move through this question. So recently I've been reading the biography of Frederick Douglass, and it's part of just learning about just our nation's great history, right? Of moving through challenging times. And in it, he describes a season in our nation where if you were an enslaved person, your owner could rent you out to work, essentially rent you out to work at a shipyard, for example, and whatever wages you earned, you would send back to your owner. And what Frederick had negotiated with his owner was, hey, I'm getting paid $9 at the shipyard. Maybe I can keep $1 and you take the rest. And that system worked for him and his owner for some time. And in his autobiographies, he would essentially equate work to freedom. And so we today, right, have this mentality, and it's not just for African American people, it's an American mentality that work equals liberty and freedom.
Yep.
And I'm so thankful, right, in this season of unlearning that we now see that that is not the case, right? Your labor is a gift and a service, but is not the totality of who you are. And so you have to make room for who you are beyond work.
Mm.
Identify, how do you serve? If you weren't at this job, who would you be and how would you show up in rooms? What would you tell people about yourself? When I was living in DC, it was big on where you working.
Oh, yes.
Yeah, which bureau,
Yes.
that was the question. Where do you work?
Uh-huh.
That is not your identity. So I think just moving out of that mental space first, right? And declassifying yourself as a worker is helpful. And when you declassify yourself as a worker, then you prioritize filling in the gaps with rest. I take a mental health day every month.
Oh, so good.
And it doesn't have to mean that I'm seeing my mental health provider. It means that I'm going into the High Museum, that I'm going to the Chattahoochee, right?
Mm-hmm.
To reset, to recharge, to connect with nature, do things that I know are beneficial mentally.
Yes.
So, and that's because I am bigger than what I'm doing in the workplace.
I want to expand on that because I'm
Yeah.
from Baltimore and I
Yeah.
lived in Maryland for a year post grad. So we would go
Okay.
into DC all the time.
Yes.
And it is funny because the first question that people ask, it's not where are you from or what do you like to do for fun? It's where do you work?
Where do you work?
And we do put so much emphasis on that
Yep.
a lot of the time when you're first getting to know people, you're really not getting to know them outside of their job.
Mhm.
And some people, they feel like their job really defines them. And it
Yep.
depends on the work that you're doing because you really can maybe see a lot of someone's personality within that. But a lot of the time, a lot of people don't like their job. So it's not something that they want to be talking about for the time being.
Right.
I love that you take the mental health day. I was going to ask you about time away from work and what people can
Yes.
do to take that break. How can leadership within corporate companies especially begin to prioritize that mental or physical well-being for their workers? Because I think a lot
Yes.
of the time you see so many people getting burnt out. You see so many people, retention rates are leaving after every 2 or 3 years.
Yes.
And a lot of time leadership is not focusing on those people and saying, hey, everybody, we're taking Friday off.
Right.
That's not happening. You're working through Friday. You're working probably to 8, 9 o'clock at night. So really interested in how from like a leadership corporate perspective, those companies can begin to really prioritize that health for their workers.
I'm so fortunate to work for a health system that prioritizes the health and well-being of the team members and employees. And so not only are they saying if we are not taking time off, that's an indicator. And I have leadership that would say, hey, it's been a while since you took extended time away from the
So good.
office, right? And so how can you build in incentives around people taking time off? For me, as a leader, if my team does a good job with a project and maybe they win a prize or award, their gift from me is time off. It's not another trophy, right?
Yeah.
It's not another
Take your vacation day.
Take your day.
Yes.
And I don't want to hear from you. And this is what I tell my team. When I'm off, you don't know me. You have never heard of me. Don't
Don't be calling me
do
on my
not
day off.
Call me.
Yes.
And they're aware.
That's
and I've
good.
trained them to understand that.
Yes.
And so and I would say you have permission to train the people around you to respect your time.
I think a lot of women especially struggle with that. They
Yes.
will have a day off and, but text me if anything comes up. No.
No.
Do not text me if anything comes up because then I would just be in the office at that point. So I love the
Yes.
idea of the boundaries within
Yes.
that. I think that's so important. I want to talk and expand more into timely access to care. So
Yes.
I really want to talk about, we're obviously going to dive into a few different avenues of accessibility,
Okay.
but I want to talk about the limits on how long you have to wait to get appointments. I was reading the study that it says it typically takes an average of 21 days to schedule a primary care visit in the United States. In a lot of cases, that's obviously inconvenient, but also that can be dangerous. 21 days can really be a life or death situation for some people in some situations.
Yes.
So I'm really interested of how you've seen timely access to care playing a major role in health issues for people in general.
We just completed a needs assessment. So that is taking information that's already been collected from places like CDC or Georgia Department of Public Health, coupling that with primary information. So interviews with individuals, just like we're doing here today,
Yes.
right? To learn about their health needs and challenges. From that culmination of data, we learned, for example, that white women have higher rates of breast cancer. Black women don't have as much breast cancer right among us, but when it's found, it's at a later stage and harder to treat.
Mm.
And because we equate visiting the physician or visiting a provider with something being wrong, we hesitate to go, and we feel like we're just going through life.
Yep.
And not only because that's been practiced among us, but for financial reasons, right? For time constraints, we just delay taking that moment to care for ourselves. And it's resulting in harder to treat outcomes and then more deaths in our community. And for me, when I see higher rates of death, that's a trigger that means we're missing out on innovation.
Yep.
We're missing out on that visioning that we desperately need to build better community because lives and years are taken from individuals. And so it's incredibly important for us to, I think, shift, right, how we equate engaging with the healthcare system. It's not sick care, right?
Yep.
We have to engage earlier, frequently, when we do have access. So I know some of the conversation is, well, there are individuals who don't have access to insurance or don't or have insurance and don't know what is available through their insurance.
Yes.
I know of a wealth of community organizations here in Metro Atlanta area who say, come whether you have insurance or not, come whether you know if something is wrong or not. We just want to care for you and be a part of that village that cares for you. They are free and reduced cost, so that shouldn't be a barrier to accessing.
Love that.
And I think the challenge is just getting the word out to all people.
Yes. I love that you brought up insurance because it's something that I wanted to dive into deeper in terms
Yes.
of the groups of people that we typically are seeing uninsured. And I would love to hear that from a research perspective of what that looks like for you. Some people are insured through their work.
Yes.
A lot of people aren't. And a lot of
Yes.
people, it's expensive. You can't just pay out of your pocket costs. I think a lot of people, they feel like insurance companies don't have their back in a lot of those cases.
Yeah.
A lot of people I've been seeing resources are feeling like it's a scam. They're saying, well, I'm paying this amount of money each month. And why is my copay and all of these other things so
Right.
expensive? Or why am I being denied claims for these surgeries that, again, are life or death? So how can people really go about educating themselves so they don't feel like they're being taken advantage of, or so they're not being taken advantage of in those senses when it comes to insurance?
I'm going to say, again, in being curious, take the approach, and I want to leverage tools that are available today. I would say use a Google Gemini, right? And
Ooh,
use
yeah.
an AI tool
Yep.
and ask, I have this type of insurance. What is available to me, right, to use towards my healthcare?
Yes.
I want to give an example. Some of the healthcare plans that we know about, they have a HSA, which is like a health savings account.
I just had to set this up for mine.
Yeah.
The other day. I just started a new job, so yep.
A pot of money, right, that you can use towards healthcare.
Yes.
It can include pelvic floor therapy that may not be covered if that's a challenge for you. It can include access to feminine hygiene products that you buy at the grocery store. You can use that HSA for that. When I worked in environmental health, you could use a HSA to make improvements in your house, to remove lead so that you don't have exposure. There's so many benefits that we just aren't aware of. And so using a tool, an AI tool, to just give you a summary or to ask it explicitly, can I use this insurance, I know about this, for massage therapy, for acupuncture, and allow it to guide you in that way.
Yeah. I want to expand on that as well,
Sure.
because I'm learning so many things today that I'm 28 years old, probably should know,
Yeah.
but don't. But do not. And
Yes.
so obviously when it comes to school systems, that can get a little bit tricky of what you're being taught in terms of what families are comfortable with, especially in private versus public schools and everything around that as well. Why aren't we taught these things growing up? Why aren't we taught about
Wow.
insurance and these basics of things that at 28, I'm saying to myself, I should know this. And I know other people that thankfully I'm insured, but I'm thinking of people that may not and don't know these other options. And you just mentioned the opportunities that they can use throughout these organizations.
Yep.
Just don't know and may not have the resources to find out about that. Why aren't we taught these things?
I think you're asking a big societal
You said that's a
question.
whole
That's the
episode.
whole thing. Why aren't we taught these things? Can I say, so I'm a educated woman. I've gone to graduate school. I've been in healthcare 20 years. And every year when they send that packet about your benefits, I get intimidated.
Yes.
I don't understand. So much so our employer knows that they have health navigators that they assign to us
I love that.
to help us.
Yes.
Us professionals in this space. It is so complicated because you have legal concerns that come into play. You have all these other systems that influence healthcare and that make it difficult for us to understand all the nuances. I think another thing is we've been taught to be fearful of the healthcare system. The only time I've engaged in healthcare and it's been health happy is around childbirth, right? And if it's a healthy outcome. Otherwise, it's like I don't want to hear about what this physician may have to say. I remember my grandmother going through cancer treatment. She said to me, I don't want to know that there's cancer in my body.
Just avoiding it then.
And so if you have a few generations of avoiding it, there's going to be a lot of missed education.
No, I love that you're bringing up different reasons that people might be afraid to go get their health checked out. And I think that is a big one. I think another big one is people, and this person mentioned it in the prompt too, feeling like a number, feeling rushed during these appointments.
Yes.
What needs to change either with work overload, systems, policies, so that doctors can begin to make their patients feel like people instead of like numbers? Because I can count on two of my hands and more, fingers, toes, everything, the amount of times that I've gone to the doctor and it felt rushed, gaslighted, and we'll talk about gaslighting within gender as well. What needs to change in that sense so people can feel not like a number and like a human?
Yes.
These are experiences. Thinking about your grandmother cancer, you're so afraid. This is life or death in some situations. And then getting there and feeling like you're number 42 for the day and 43 is on its way out, you got to hurry up, is not a good feeling at all.
So I would say to the broader American healthcare system, it is working as designed. It is designed, right, to churn more patients, to increase and improve revenue, right? That, unfortunately, is part of the system that has been designed. You will find that the physicians, the clinicians, the nurses that you are engaging with, they are, for lack of a better word, victims of that system as well.
Yeah.
They experience burnout at tremendous rates. You even have some leaving the profession and some committing suicide.
Oh my gosh.
Well, I shouldn't use the word committing, but some experiencing and attempting suicide because of the stress with a system, again, that is working as designed. So you find that there are niche providers come in all race, all creeds, all language backgrounds that are saying, that system doesn't work for me. I'm going to work in a different type of healthcare. They're building their own. These are called concierge practices.
Okay.
And they offer, again, they don't accept, right, your normal insurance. So it will be on you to then take your HSA card and use that to apply to the visit. It's going to take some work for you to be able to then bill your insurance on your own.
Right.
It is possible, but you have to navigate in some ways away from what has been already created. What's going to help? I think taking non-traditional, again, the health system would have to be curious, taking non-traditional approaches. So not having the physician as the only leader in this space. How do we have aiding hands? In the example of women's health and specifically pregnancy, you have a gynecological obstetrician provider, you have a nurse midwife, you also have a doula, right? You extend the healthcare services so it doesn't lay on one person to have to churn through patients.
So important. I love that you brought that up because I wanted to talk about the turnover that we're seeing. I know we're seeing like a shortfall of primary care doctors, and a lot of that might come down to burnout or just overall workload, or maybe just not being happy in the profession because it's too much. And I think that's really important to dive into that. I want to dive into how some patients sometimes might feel like their doctors are really impatient. And if it comes down to ego from doctors or just the overload of their work. I think I was reading this study that said the average patient gets to speak for between 12 and 15 seconds before the physician interrupts them. And it made me laugh reading because I was thinking about having some health stuff this past year. I'm starting to tell my story of what's going on. And then they cut you off halfway through and you're like, okay, do we typically see that coming from ego, stemming from ego because they feel like they're the smartest person in the room? Okay. And let's be honest, against me, you probably are. Or does it just come down to, again, time constraints, them having so much overload, so many patients that they can't spend 30 plus minutes hearing about your story and what's going on with you?
I want to interject one thing. You are the expert of your body. So they're not smarter than you about your body. I want to make that clear.
I needed to hear that.
Yes. Yes, again, the way the payment system works up, if you're with someone for more than 15 minutes, sometimes you're penalized.
Really?
Yeah, they are working in very tight.
I did not know that.
Tight constraints. And so that causes the rush. There's also, I think, some cultural sentiment in that as well. So, for example, we know in African American language exchange, part of the way we communicate is call and response.
Yes.
And so what you find is as we're speaking, maybe we come again and speak, we kind of talk over each other.
Yes.
And we build that communion. Yeah. And the way that physicians and healthcare providers are trained, they're not built to communicate that way, right? So all of they know is like, you just keep talking. I need to cut you off and move on. Yeah. Instead of, we're doing a call and response type activity. And that's why sometimes your engagement with the provider feels cold. Because they don't understand the best ways. Yes. So there are ways that we need to improve cultural competency, right? And building up the skills about how you talk to different types of people with backgrounds. They're, again, victims of the system. And again, you have opportunities to come out of the system. I know of a primary care office here in East Point in Georgia, where started by a Black woman physician. She has 1 hour appointments with patients. She came out of the system.
So much trust is built within that, though, which is so important. Like an hour with your doctor.
An hour.
Is amazing. I want to go more into the cultural barriers that we're talking about because it did make me think of how some people might be anxious to go to the doctor if there are language differences, if they feel like they might be judged for certain lifestyle choices that might be ingrained with their culture and things like that. How can people go about finding resources that are aligned with their culture or finding providers that are understanding of their culture on the day-to-day basis? Because I'm thinking of someone who first language might be Spanish, for example, and they might feel more comfortable speaking about their issues if they can have a doctor or a nurse or someone in the room with them that they can speak in their first language.
I want to validate what you just shared. So I work with a nonprofit Hispanic serving organization called Ser Familia, and they shared that there was a woman, she spoke both English and Spanish, who had experienced trauma, and they were looking for a behavioral health specialist for her, but she could only speak about her trauma in Spanish. Wow. She couldn't communicate it in English. So how do we connect her, right, with a provider who understands that she's not going to flip to English, she needs only Spanish to get through. Yes. And so it's so important. I think word of mouth is still very, very important. When you are calling up a physician's office, or a practice or wherever you're getting healthcare, you are a customer in that space. And you have permission to ask for reviews, right? You have permission. I would like to hear from someone you've recently served. Wow. They're vying for your business, so to speak. Yeah. Right? So you don't have to just accept what they're giving you. You can push back. Hey, I would like to learn more about how you've been successfully serving this group of people and give me evidence of that. You can request that.
That's so important. Yeah. You brought up a good point that I wanted to talk to you about as well within that. Good healthcare versus good customer service. Yeah. I was watching this video where this woman was describing how a lot of people might have trouble distinguishing between the two because good customer service is right. The customer's always right. We're doing everything in our will to make sure that you're super happy. And good healthcare might not mirror that in the sense where it might not be medically sound. Your doctor might have to challenge you of what you come in wanting because it may not be what's best for you. Yep. Do you feel like people have trouble distinguishing the two when it comes to their own personal health Or is it good for people to put good customer care within the lens of good healthcare at the same time?
That's such a good question. I would say that there is a power dynamic in a physician or healthcare provider client patient relationship that makes it difficult to discern when someone's trying to be when they're admonishing you versus really wanting to help you on your journey.
Yes.
And so it's a critically important the relationship building, but you don't get that in the 15 minutes. Right? You don't get the relationship building piece. So I come from women, for example, I tell this story to myself often. I was in middle school, and that's the time when you start to start feeling yourself, right? You start, my family say, start smelling yourself. You feel big. And I started becoming a little mean, right? I was talking negatively about people in my class, and I had a teacher, and she came to me and she said, "You're a leader. You will not be a mean girl." And I remember that today.
Stuck with you.
But it was a direct communication, but it came from a place of, I care for you. I see you. I know you. I love you. You're not going to be a mean girl. But when you're in a physician's office, they're like, I want you to be healthy, but they don't know you. Right? So you're not receiving it in the same place. You're not receiving it in the same place.
Not at all.
I know from working with caregivers, and I call all physicians, clinicians, those providers, caregivers, they really do want the best for patients. And I know it comes out all kinds of ways.
Yes.
They really do. They get graded on it. Right? On how well they treat you and what your reports of them are. They get graded on your health outcomes, how well you're doing. They want you to be healthy. But again, we're missing that part. They don't know you.
Yeah.
So how do you foster knowing in 15 minutes? I don't know. That's a big question.
No, it's so difficult. And it goes back to, I love the hour practice that you were talking about, that you had that time, because building that trust with your doctors, with that staff really allows people to feel like they can advocate for themselves better, which I think is very important, that advocation point. Why do you feel like women especially, and we'll get into more of like the research behind it in terms of gaslighting, but why do you feel like women especially have so much trouble advocating for themselves within healthcare system, medical environments, even a yearly checkup at a doctor's appointment where something might be bothering and then they're like, oh no, everything's good, keep it moving. And then maybe you're writing a review after, or sending an email afterwards after you didn't speak up in that appointment. Why do you feel like women struggle with that?
Why do we struggle with telling our hairstylist they're going the wrong way? Right? Why do we struggle?
I love the braids. Going home, taking them out after 8 hours in the chair. Yes.
What? We have an opportunity, right, to build up women and girls to not only be receivers. If you think of just about the physical role that people born with, female anatomy have taken on, is to receive a seed and to harness it, right, in our bodies and push it out, and we fade into the background. That's when you're becoming a mother, right? Or a birth giver. That's what happens. And so I think some of that is in how we train and teach girls generally, that you receive and you harbor. Think about all the images that we've harbored about who we're supposed to be. We let those ruminate in our minds. We fade into the background. I think we just have to have a complete overhaul of how we educate and train women and girls.
Yes. Yeah. Going in, I think with that education can make you believe in yourself more to speak up for yourself, because it's really important. I think a big part of that, and I want to get into the gaslighting, because I think a lot of women sometimes might have trauma from past doctors who gaslight them and pretend, this woman, I'm having these issues with my period. And it actually reminded me of a situation that I was having some similar issues, and doctors were saying things like, oh, drink more water, or let's just put you on birth control. And I'm saying, this isn't working for me. I need something else. So I really do want to talk about the gaslighting within women's health. We're seeing so many female patients continuously gaslighted about their physical and mental health in some situations. We're seeing it delivery rooms, resulting in sometimes women dying if they're saying they're in pain after these things. And especially with Black women, I think. Can you dive into the gender biases and explain why gaslighting is happening so often for women, especially within this field?
Well, one, I would say fire people who are not listening to you. I wanted to bring in that perspective. Like, you're a paying customer.
Yep.
You have permission to fire your physicians and providers who are not working for you.
Yes.
You don't owe them access to you, your body, your thoughts, anything. Get rid of them if it's bad. Another piece is I feel that working in pairs and twos helps because the messaging gets reinforced. I want to bring up a political example.
Okay.
I think it was during one of President Obama's administrations where he had a lot of female leadership. And they reported, though, that they were bringing up ideas in the policy rooms and no one was listening. And so they made a pact. When one woman raised a concern or made a policy suggestion, all the other women in the room would go and say, I agree with Jennifer.
Love that.
I agree. And they would go one by one and say, I agree with Jennifer with what she said. And it was that doubling down on the message with reinforcement that made a change. And so when you walk into a clinical environment with reinforcement, whether it's mama on the phone, whether it's your best friend who's actually in the office with you, it makes a difference, right? Because now they see there's support here and somebody's validating this experience. It's unfortunate that has to be the case, but until we have more systemic change around just valuing women's voice, it's something that's necessary.
Bring in your people.
Bring in your people. We have a challenge, I think, today with villages, right? People say, well, I don't have my village with me. My sister lives in another state.
Yeah.
Your village, right, includes that best friend, that roommate, that it doesn't have to be just family member, but somebody you trust.
Yes. That's really good advice. I have a friend I was talking to the other day who she was afraid to go to her first GYN appointment. And I was like, dude, I will come with you.
There you go.
Sometimes it's nice just having someone even in the waiting room knowing that they're out there and you can come back and talk shit or whatever you need to do afterwards. I think that's so good. I wanted to expand on that too, the gaslighting. How often are we seeing the underrepresentation of women in research or women's research playing a role? Because I was reading this study that said before 1993, women were rarely included in clinical trials. Which is so crazy to think about because the 90s was really not that long ago. So how often are we seeing some of this gaslighting or not even having answers for some of these women's issues stemming from underrepresentation in trials, research? And I know obviously we're expanding on that and that's evolving today. Obviously we have a ways to go, but really interested in how that can play a role into that.
So they, for a long time, would say we're not doing research with women because of their hormonal fluctuations. And so it's going to make it hard to have standardization in the process. But you need to understand the fluctuations.
Exactly.
To understand how it's going to impact the body.
Yes.
So we're finding that even understanding how much of a prescription medication should be given, it may be inaccurate for a woman's body because of a lack of education.
Yes.
Even the tools used for women's exams, they most recently, found out that there was so much pain associated with inserting an IUD for reproductive health.
Yes.
Why is it taking until 2025 that we now get pain relief for something that for over a century has been difficult and dangerous and painful for women?
Yes.
So it's coming, I'm glad these things are coming to light. I think social media has helped to push things to awareness, but it's resulting in women have been going through lots of pain unnecessarily because of it.
I was going to ask you what are your personal views? It's so fascinating talking to someone who are seeing a lot of these things on the day-to-day basis. If you've seen social media playing more of a positive role into upward movement in the healthcare system or a negative role, because I really do see, even on TikTok, you're seeing such opposing views. And sometimes I see something that's so on the opposite spectrum. I'm like, oh my gosh, there's 13-year-olds that are watching this and they're just being so misinformed. But at the same time, then I see another video that's agreeing with what I believe. And I'm like, I'm so glad that 13-year-olds are seeing this. So I'm interested in how you feel like social media has really played a role into movement within the healthcare system.
I love that it's given accessibility, right, to individuals to learn more, to even learn about health career fields.
Yes.
I think there is danger, as with any tool. I mean, this came when the internet was coming big. How do we make sure that there's still critical analysis happening with information presented? And I think we really have to work on, in the school system, making sure we critical analysis skills, keep them up, keep them going.
Definitely.
Question, again, be curious. That's going to help us navigate this time.
Yeah, accessibility is probably like the biggest thing of that, which is so good.
Yes.
Within accessibility too, and having the privilege of being able to see so many doctors, I want to talk about doctor hopping.
Oh.
I was reading some issues that actually might come from seeing so many doctors at one time period, and I'm interested to hear your thoughts on this. They mentioned fragmented care, so the doctor is only getting a portion of your medical history that might lead to incomplete information, maybe a delay in diagnosis and treatments, maybe your medications, if you're getting prescribed different things from doctors, not mixing very well, causing more health issues.
Yep.
When someone is having an issue with their health, do you feel like they should stick with one or two opinions, maybe get a second opinion, but no more than that around this doctor hopping issues that I just mentioned? Or in some cases, is it good to get opinions from multiple doctors, no number in mind? I'm really interested of your thoughts on that.
You know what? I think no number in mind is dangerous. I don't recommend 20.
122.
Right? I don't. But I think if you, for me, there has to be alignment with head, heart, and gut with any decisioning. So if you're with the physician, it's like, okay, I think what you're saying is after right thinking, but my gut and my heart aren't lining up with this. I think it's okay to move on and go to a different space. Take your materials with you. I would like a copy of my record. I'm downloading all of my stuff to take with me to the next place. You are allowed to do that.
Yes. I think so many people, I've done it too, where I'll be working with a few doctors and they have that information and I just don't follow up, almost feeling like that's theirs and there's like a sense of loyalty within that.
Yeah.
Now I know to get those copies, upload it to my MyChart, save it to my personal documents so I can bring it to the next place.
There you go.
I think that's really, really good advice. I have a few more questions for you. I do want to talk about generational differences and how different generations are really engaging with healthcare. Okay. How have you seen perhaps a Gen Z versus millennial versus Gen X, and maybe social media obviously plays a role into that, but I'm really interested in the different types of engagements that you might see, especially for women across these different generations.
Yeah. It's interesting. I go to conferences and they always talk about, what is the next generation going to be? And usually they're thinking negatively, like, it's going to be messed up. And I love that Gen Z is not a respecter of persons. So I have seen...
So true. They do not.
Even as employees, right? They're not as scared of these doctors.
No.
At all.
And they'll be filming you at the same time with it. Okay. Yes.
And stand on business completely. I love it.
Yes.
And we need more of it.
Yeah.
I love that we have gotten to this place of empowered, right, voice.
Yeah.
Where people will use every tool, whether it's social media or they're writing, everything that they need to advocate and say the truth. I think that's great.
Yes. They are not afraid to speak up. And some videos that I've seen, they are really not afraid to speak up to the front desk staff at some of these offices.
Nope.
I do want to talk about the front desk staff and the importance that they really play a role into people's overall anxiety entering into a doctor's office and building that trust with the doctor. They really curate your experience from the moment that you walk in. And sometimes you have really amazing experience with them. You're on time, they sign you in, they're really kind. And sometimes even from a phone call of you scheduling that appointment, it can be an awful experience that place might be losing business.
Yes.
Attitude, just making you feel stupid for even calling. Can we talk about the importance of the front desk staff and why it's important for hiring managers, HR, whoever is staffing these people to really hold them accountable in creating a positive, healthy environment for people who are entering into an office?
When you go on your Caribbean vacation, you leave wanting to transform your life, right? Mm-hmm. Because you've had the best experience. Why? Because they welcome you as soon as you come in, right? They make you royalty when you enter. And again, put you in a place of visioning.
Yes.
Way past that vacation. We can do the same thing in healthcare. They do it in the hospitality industry. We need to bring that same hospitable environment to the healthcare arena so we can foster knowing and engagement that people want to better themselves.
Yes.
Yeah.
That hospital is so important.
Absolutely.
There's been so many times where I've called and halfway through the call, I'm like, all right, I'm calling the next spot. So I love that. And we're unfortunately out of time. So just last words of advice that you would like to offer this person, that you would like to leave everyone listening in today. What would you like to say?
So I'll say this, we always get that advice when go low. Sometimes they say go lower, but we're going to go high in this time. And when I say go high, when you're encountering challenges and problems, meaning go and say, I want to talk to an administrator. I want to talk to the person on call, your manager on call, because my experience hasn't been pleasant. Again, these physicians, front office staff, they are graded on how they treat you. And we as leadership in healthcare, we want to be aware of who's not living up to the values and the vision and the mission of our organization so we can course correct. So we need you to tell us what's going wrong so we can course correct.
Remembering that they have a voice in it as well.
That's right.
Yes,
That's right.
I think that's so important.
Yes.
Thank you so much for being here today. I wish we had more time. I'm going to have you back on. This was so much fun. I hope you guys enjoyed getting to know Elise and hearing about this episode. I know I did. If you want to hear more episodes with wonderful guests like Elise, you guys know where to find us on all of our social media, TikTok and Instagram at Unlicensed Advice. And again, of course, if you want to write in and get some advice from all of our different female guests, head to that link in bio on my Instagram or my website, www.unlicenssedpodcast.com, and we will get it answered for you. But I love you guys, and we'll see you next week.